Hi, my name is Isabel Fitzpatrick. This is my oral exam for medical terminology, fall of 2025. Here's my notebook, just for proof that I have my list. My first word is gingivectomy. The patient underwent a gingivectomy to remove the excess gum tissue in the patient's mouth. Arteriostenosis. The patient's symptoms were caused by arteriostenosis in the artery, which was caused by a blood clot. Tracheostomy. The patient had a tracheostomy where they inserted a tube into the opening and it helped him to breathe better. Cardiomegaly. The patient was diagnosed with cardiomegaly, an enlarged heart, likely due to his high blood pressure. Ventriculometry. The doctor used ventriculometry to measure the intraventricular pressure in my brain. Hemiplegia. The patient had hemiplegia after she suffered from a stroke where she had difficulty in controlling her arms and leg on one side of the body. Pneumocentesis. After tests were done, the doctor found fluid in her lungs and decided to perform a pneumocentesis to remove the fluid. Choriocarcinoma. The patient complained of bleeding heavily out of her vagina after pregnancy, increased pelvic pain, and an enlarged uterus, which was later diagnosed as choriocarcinoma. Dyspnea. The patient was experiencing dyspnea shortly after a walk. Dyspepsia. The patient suffers from dyspepsia shortly after eating, which causes her to have abdominal pain. Bronchoscopy. The doctor performed a bronchoscopy to diagnose the patient's persistent cough. Lymphocytopenia. After chemo, the patient may develop lymphocytopenia as a side effect. Ileostomy. The patient has an ileostomy and uses a stoma bag to collect the waste. Esophagoscopy. The doctor performed an esophagoscopy to look for anything out of the normal in the esophagus. Anhidrosis. The patient had anhidrosis and his body could not cool itself down, so he was at high risk for heat stroke in the summer. Osteotomy. In order to remove the patient's foot bunion, the doctor performed an osteotomy to resolve the issue. Epistaxis. The patient had minor epistaxis after he bumped his nose. Hepatomegaly. The doctor diagnosed her with hepatomegaly after she complained of fatigue, jaundice, nausea, and swelling in her abdomen. Narcolepsy. He often experienced extreme tiredness, and he was later diagnosed with narcolepsy. Tachypnea. After a run, she developed tachypnea and needed oxygen to regulate her breathing. Chondromalacia. The runner complained of recurring knee pain, which was later diagnosed as chondromalacia. Arthroplasty. As people get older, they may need a hip or knee arthroplasty to relieve their pain. Sigmoidoscopy. The doctor recommended a sigmoidoscopy to check the patient for colon issues. Rhinorrhea. In winter, I experience increased rhinorrhea due to the cold weather. Pancreatoma. She was diagnosed with pancreatoma after the doctor found a growth on her pancreas. Arthrectomy. After years of pain, her knee joint was removed with an arthrectomy. Glomerulonephritis. The patient suffered with chronic kidney disease that later ended up being caused by glomerulonephritis. Bradykinesia. The patient's bradykinesia makes tasks take longer than normal. Atelectasis. The patient developed atelectasis and needed to do breathing exercises in order to reinflate her lung. Diaphoresis. Extreme heat caused her to have diaphoresis, which caused her to become dehydrated.